Meanwhile, on the third floor, Dr. Alex Sterling stepped out of the doctor's lounge after a video conference with European specialists. His expression exhibited the pride of a man who had just received high praise from the biggest names in world cardiology. In the hallway, he encountered Dr. Alistair Finch, the hospital CEO, a man of 60 with graying hair and eyes that seemed to carry the weight of decades of medical experience. "Alex, we need to talk about the patient in 307, Alistair said seriously. There was a potassium level alteration that almost caused serious complications. The surgeon frowned. "Impossible. I reviewed the labs myself this afternoon. Apparently something was overlooked," the CEO insisted. Fortunately, Nurse Delilah requested new tests in time. Alex felt his pride give way to irritation. He hated being corrected, especially in front of other doctors passing in the hall. "There must have been a lab error," he justified. "I'll look into it tomorrow. Now, if you'll excuse me, I need rest. I have a complex surgery in the morning." As he walked away, Alex couldn't help but overhear one of the nurses comment to Alistair, "It was that janitor again, wasn't it? She's the one who flagged the potassium, just like she did with Mrs. Hayes's allergy." Alex froze, recalling the woman with the cleaning cart, who had the audacity to suggest checking the patient's potassium levels. His face flushed with anger. Who did that employee think she was, interfering in medical matters? On the other end of the hospital, Eleanor Vance was finishing her shift. In the empty locker room, she changed from her blue uniform into simple clothes, denim pants and a cotton shirt without any pretense. She looked briefly in the mirror, seeing beyond the facade of the janitor everyone knew. Behind that simple appearance lay years of intense study, residencies at the country's best institutions, and internationally recognized talent, a life she had deliberately left behind. As she put away the bandana covering her hair, a small photo slipped from her pocket. The image showed a girl of about 10, smiling with the same intense eyes as Eleanor. She held the photograph for a few seconds, allowing herself that rare moment of vulnerability, before carefully tucking it back into her wallet. "Tomorrow's another day, Julia," she murmured to the photo. "Another day where Mom does what she can the best way she knows how." Eleanor walked out the back door of Mount Olympus. The late-night Manhattan breeze greeted her. As she waited for the bus at the deserted stop, her thoughts drifted to the patient who almost received the wrong blood, to Mrs. Hayes and her unlogged allergy, and to the contempt in Alex Sterling's eyes. For 3 years she had kept her secret. For 3 years she was content to help from the shadows, finding a peace she thought impossible after what happened in Chicago. But how long could she maintain this double life? How long could she bear witnessing mistakes she could directly prevent, lives she could more directly save? The bus arrived, interrupting her thoughts. Eleanor boarded, choosing a seat in the back. As the vehicle crossed the empty streets, she watched the city lights reflected in the pavement, thinking that her life, like that reflection, was only a distorted version of what it once was. The late-night confession. The digital clock in the doctor's lounge read 3:20 a.m. when Dr. Alex Sterling threw his stethoscope onto the table in frustration. The emergency procedure he had just performed on the patient in room 412 had been more complicated than anticipated, and exhaustion was beginning to weigh on his shoulders. "Coffee?" a soft voice offered. Alex looked up, finding Eleanor holding a thermal carafe. For a moment he thought of curtly refusing, but the aroma of the coffee overcame his pride. "Yes," he replied, handing her an empty mug. "Thank you." Eleanor poured the coffee in silence, avoiding eye contact. As she discreetly organized the small pantry, Alex watched her with renewed curiosity. There was something about her hands, the precise, delicate way she held objects, that seemed out of place for someone who handled cleaning products all day. "You're the janitor who commented on the potassium levels for the patient in 307, aren't you?" he asked abruptly. Eleanor froze for a second before answering naturally. "Yes, doctor. I apologize if I overstepped my bounds." Alex took a sip of the coffee, surprised by its perfect flavor. "How did you know that?" "About the potassium. I've worked in hospitals for a long time," she replied vaguely. "You learn a few things listening to the doctors." Alex murmured, not entirely convinced. "And were you also the one who noticed the incorrect blood type last night?" Eleanor maintained a neutral expression. The nurses handled that situation, Doctor. That's not what I was told, he insisted, studying her reactions. It seems we have a janitor who knows more medicine than some of my residents. A tense silence hung between them. Alex expected a confession, an explanation. Eleanor simply finished tidying the pantry. If you'll excuse me, Doctor, I have other sectors to clean before dawn. As she turned to leave, Alex noticed a small scar at the base of her neck, partially covered by her uniform. A surgical scar he instantly recognized, the kind of mark left by an emergency tracheostomy. Wait, he called out impulsively. What is your full name? Eleanor Vance, Doctor, she replied simply, leaving before he could ask more questions. Alex was left alone with his mug of coffee and a growing curiosity. Was there more to this janitor than met the eye? He drank the last sip thoughtfully. Tomorrow, he decided, he would find out more about this mysterious Eleanor Vance, the trauma and the turning point. In another corner of the hospital, Eleanor pushed her cart down the corridor of the pediatric wing, where the silence of the night was occasionally broken by distant cries. This was the hardest part of her nightly routine. Passing pediatrics always brought back memories she preferred to keep dormant. Eleanor, Nurse Sarah called out in a whisper. I need your help, please. The young nurse led her to a room where a girl about 9 years old cried silently, clutching a teddy bear. This is Maria. She's had a fever for 3 days and the doctors still haven't figured out why. She won't take her fever reducer and, well, you have a way with kids. Eleanor felt a familiar clench in her chest. The girl in the bed was the same age Julia would be now. She approached carefully, sitting on the edge of the bed. Hi, Maria, can I tell you a secret? She began gently. This hospital has a special rule. If you close your eyes and pretend this medicine is strawberry juice when you swallow, it actually tastes like strawberry. The girl looked suspicious. That's not true. Let's make a deal, Eleanor smiled. If it doesn't work, tomorrow I'll bring you a chocolate to make up for it. But you have to pretend really hard, okay? To Sarah's astonishment, Maria accepted the medication. As Eleanor stroked the girl's hair until she fell asleep, the nurse watched in admiration. How do you do it? She asked when they left the room. We tried everything with her. Eleanor shrugged. Children need a little magic sometimes, especially when they're scared. Do you have kids? Sarah asked innocently. The silence that followed was answer enough. Sarah realized she had touched a sensitive chord. I'm sorry, I didn't mean to. It's okay. Eleanor recovered quickly. I did have a daughter, yes. She loved stories about magic. Before the conversation could continue, the hospital loudspeaker called Sarah to an emergency, leaving Eleanor alone with her memories. She continued her work mechanically, while her mind traveled to another time. Chicago 5 years ago. Dr. Eleanor Vance, we need you in the ER immediately. The voice on the intercom sounded urgent. Eleanor dropped the report she was analyzing and ran down the corridors of Chicago General. As chief of cardiovascular surgery, she was rarely called directly to the ER, unless the case was extremely grave. When she entered the trauma room, her world collapsed. On the gurney was a small girl, brown hair matted with blood, face nearly unrecognizable from the injuries. But Eleanor would recognize that small body under any circumstance. Julia, the name escaped her lips like a desperate prayer, the accident that changed everything. The school car hit by a truck, the emergency surgery that lasted 12 hours, the hands which had never failed in 30 years of career, shaking as she fought to save her own daughter. And then, the absolute silence in the operating room when the cardiac monitor emitted that continuous, relentless sound. New York, present time. Eleanor? Are you all right? Delilah's voice brought her back to the present. Eleanor realized she was standing in the middle of the corridor, her gaze lost in the distance. Yes, just tired, she replied, forcing a smile. You should go home. Your shift ended almost an hour ago. Eleanor nodded, but before she could answer, a commotion at the end of the corridor drew both their attention. Dr. Alex Sterling and a team of residents rushed into room 510, where a post-operative patient had been admitted that afternoon. Pressure dropping. Sinus tachycardia. He's going into shock. The alarmed voice of one of the residents echoed down the hall. Delilah ran to help, while Eleanor, moved by instinct, followed her to the room door. From where she stood, She could see the cardiac monitor and the frantic movements of the medical team. The patient, a man about 50, showed clear signs of internal post-operative bleeding. "We need to take him back to surgery," Alex announced. "Probable suture dehiscence. Prep the emergency OR." As the team mobilized, Eleanor noticed something on the medication monitor. The intravenous anticoagulant was still being administered, when it should have been suspended hours before the surgery. "Doctor," she called out instinctively. "The heparin drip." Alex, in the middle of the crisis, barely registered who was speaking. "What?" "The anticoagulant is still being administered," she pointed to the monitor. The information dropped like a bomb in the room. Alex quickly checked and ordered the immediate interruption of the medication. That error could easily cost the patient his life, turning a small post-operative bleed into an uncontrollable hemorrhage. With the medication stopped and hemostatic measures implemented, the patient began to stabilize, avoiding another emergency surgery. When the situation was under control, Alex finally realized who had spotted the fatal error. "It was you," he said, staring at Eleanor with a mixture of gratitude and confusion. "Again." Eleanor had already backed away into the corridor, returning to her cleaning cart as if nothing had happened. Alex followed her, determined. "This is no coincidence," he stated, blocking her path. "No janitor would know about drug interactions or recognize an anticoagulant by its commercial name." "Dr. Sterling, please." Eleanor tried to move past, but Alex didn't yield. "Who are you, really?" he insisted. "Nurse? Medical student? Don't tell me you just learn by listening to the doctors, because that's absurd." Their eyes met, his demanding answers, hers pleading for silence. For a moment, Eleanor's mask seemed to falter, revealing not the subservient janitor, but someone with a presence Alex couldn't decipher. "Just let it go," she asked in a low voice. "Please." "You saved that man's life today," Alex replied, his tone softer now. "And possibly other patients before. Why hide?" Before Eleanor could answer, a grave voice interrupted the conversation. "Dr. Sterling, I need to speak with you in my office." It was Dr. Alistair Finch, the hospital CEO, observing the scene with an unreadable expression. "Now," Alex hesitated, looking from Eleanor to Alistair. "We will continue this conversation later," he promised Eleanor before following the CEO. Alone in the corridor, Eleanor took a deep breath, sensing that her carefully constructed world of shadows was beginning to crumble. Perhaps it was only a matter of time before her past caught up with her. The question was she ready to face it? The reluctant legend. Dr. Alistair Finch's office was bathed in the dim light of dawn, illuminated only by a desk lamp that highlighted the serious features of the Mount Olympus CEO. Across the desk, Dr. Alex Sterling waited impatiently, still intrigued by what he had just witnessed in room 510. "What is going on with that janitor, Alistair? How did she know about the anticoagulant? And it's not the first time she's demonstrated advanced medical knowledge." Alistair sighed deeply, adjusting his reading glasses before responding. "Alex, there are things in this hospital that operate on a delicate balance. Eleanor is a special employee." "Special how?" Alex insisted. "She clearly has medical training. I saw how she observes patients, how she analyzes the monitors. No one learns that by listening to doctors, as she says." The CEO remained silent for a few moments, as if weighing every word before speaking. "What I am about to tell you does not leave this room, understood?" he finally said. "Eleanor Vance is working in cleaning by her own choice. That's all I can say for now." "By her own choice," Alex repeated incredulously. "Who would choose to clean floors when they could be saving lives?" "Someone with very powerful reasons," Alistair replied enigmatically. "Respect her space, Alex. It's a personal request." Alex studied the CEO's face, realizing there was more to the story than Alistair was willing to reveal. In his 15-year career, he had never encountered such a peculiar situation. She just prevented a patient from dying from a medication error, he argued. If she has medical knowledge, why isn't she practicing her profession properly? It's almost unethical to leave her cleaning corridors when she could be formally contributing. Alistair removed his glasses, rubbing his tired eyes. "There are many ways to contribute, Alex. Not all of them involve a white coat and a pompous title on the door. Now, if you'll excuse me, we both need rest." The day will break soon. Alex left the office more confused than when he entered. For instead of answers, he had only obtained riddles. As he walked through the silent corridors towards the doctor's lounge to retrieve his belongings, a determination grew within him. He would find out who Eleanor Vance really was. On the other side of the hospital, Eleanor finished putting away her cleaning supplies. Her hands trembled slightly, not from fear but from adrenaline. How long had it been since she felt that rush of energy that accompanied an emergency medical intervention? That familiar sensation of having made the difference between life and death. For 3 years she had avoided this feeling, staying in the shadows, intervening only when absolutely necessary. But today she had crossed the line she had drawn for herself. She had spoken aloud, pointed out the error, drawn attention to herself. And the worst, Alex Sterling now suspected her. "Eleanor," Alistair's voice came from behind her. "We need to talk." She nodded, following her old friend to a small empty meeting room. There, away from curious eyes, Alistair allowed the formality to dissipate. "What happened today?" he asked gently. "You were always so careful." "The patient could have died, Alistair," she answered simply. "I couldn't stay silent. Alex is asking questions. Many questions. What did you tell him?" "Nothing specific," Alistair assured her. "But he's persistent and intelligent." Eleanor ran her hand through her graying hair, now loose from the bandana she wore during work. "Maybe it's time to look for another hospital and start all over again." "Eleanor, how long will you keep running?" The question hung heavy in the air between them. Eleanor looked away toward the window, where the first rays of sun were beginning to color the New York sky. "I'm not running," she finally replied. "I'm surviving." "This isn't surviving, my friend. It's existing by half." Before they could continue the conversation, Alistair's pager buzzed insistently. He checked the message with a worried frown. "Emergency in the operating room," he informed her. "It looks like Alex is in trouble." Without thinking, Eleanor followed Alistair down the corridors towards the OR. At the entrance to the restricted area, he stopped. "You can't go in there, Eleanor." "Not as a janitor," she nodded, stepping back. "What's happening?" "Complications in Senator Thompson's surgery. Alex is operating." Eleanor knew the case, a high-risk heart transplant on an elderly patient with multiple comorbidities, a surgery that would make headlines if successful. The kind of procedure Alex Sterling loved to take on, both for the technical complexity and the notoriety it would bring. Alistair disappeared through the double doors, leaving Eleanor in the corridor, her mind involuntarily analyzing the possible complications that could occur in such a case. 30 minutes passed as she stayed near the OR entrance, observing the frantic movement of nurses and technicians going in and out. Something was wrong. Very wrong. Finally, Alistair emerged, his scrubs stained with blood, his face pale. "Hyperacute rejection," he informed her in a low voice. "Alex is losing the patient. The new heart won't function properly." "Are they trying ECMO?" Eleanor asked instinctively, referring to the extracorporeal cardiopulmonary support. "Yes, but we're having cannulation issues. The vessel is collapsing." Unconsciously, Eleanor began speaking in technical terms, suggesting alternative procedures, discussing emergency immunosuppression protocols. For a moment, Alistair saw in her again the brilliant surgeon he had known 2 decades ago, not the janitor who now hid under a blue uniform. "Eleanor," he interrupted softly, "they need help in there." She froze, understanding what he was suggesting. "No, Alistair. I can't. A man is dying." "Alex is good, very good, but this case—" Alistair held her shoulders. "You've faced situations like this before. You know what to do. I've been away for years. I don't have a license. I can't just walk into an operating room and—" "Leave that to me," Alistair interrupted, determined. "I'll say I called for an emergency consult. No one will question it, given the patient's importance." Eleanor felt a whirlwind of emotions, fear, reluctance, but also an unmistakable spark of adrenaline. That call every doctor feels when they are needed, when a life depends on their skills. "You have 5 minutes to change," Alistair indicated the women's locker room. "A surgical gown and temporary badge will be there." Before she could respond, he was already on the phone, organizing the details of her improbable entry into the surgical field. Back in the white coat, in the locker room, Eleanor stared at the white surgical gown hanging on the rack, feeling as if she were looking at a ghost. With trembling fingers, she exchanged the janitor's uniform for the sterile surgical attire. When she clipped the temporary consulting physician badge to her lapel, it was as if she were putting on an old skin again, one she had abandoned by choice. "I'm making a mistake," she murmured to her reflection in the mirror. "I promised myself never again." But the image staring back was no longer the janitor Eleanor. There stood Dr. Eleanor Vance, the legendary cardiovascular surgeon who had once performed procedures considered impossible. When she entered the operating room, the atmosphere was one of absolute tension. Alex, covered in sweat even under his surgical cap, was fighting to control massive bleeding, while a nurse tried to maintain the patient's blood pressure with vasopressors. "Who are you?" Alex asked brusquely, noticing her entry without taking his eyes off the surgical field. "Dr. Vance, transplant consultant," she replied with a calm she didn't feel. "Dr. Finch called me to assist. We don't need consultants. We need a miracle," Alex replied through clenched teeth. Eleanor approached the table, observing the cardiac monitor that showed increasingly frequent arrhythmias. "May I take a look?" Before Alex could protest, she was beside him, observing the transplanted heart that refused to pump adequately. "The aortic anastomosis is leaking," she observed, "and there are clear signs of hyperacute rejection. We need a higher dose of methylprednisolone and to start plasmapheresis immediately." Alex looked at her with surprise. "We're already at the maximum dose of corticosteroids." "Not by the Helsinki approach," Eleanor countered, referring to a little-known experimental protocol. "May I?" After a moment of hesitation, Alex stepped aside slightly, allowing her access to the field. With precise and secure movements, Eleanor began to redo the problematic anastomosis, speaking calmly as she worked. "Nurse, prepare 1,000 millimoles of methylprednisolone for rapid infusion, and we'll need fresh plasma as well." As her fingers worked on the delicate cardiac tissue, the tension in the room began to shift. What was once despair gradually transformed into contained hope. Eleanor operated with an almost artistic fluidity, every movement so precise it seemed choreographed. Alex watched in silence, a mixture of admiration and confusion in his gaze. Those hands were not just those of any consultant. They were hands that had performed thousands of surgeries, hands with the kind of confidence that only decades of experience could grant. After 40 minutes of intense work, the monitor began to show signs of improvement. The transplanted heart, previously reluctant, now began to assume its role in the new body. "It's working," murmured one of the assistants, almost with reverence. Eleanor placed the final sutures, ensuring there were no more leaks. When she finally stepped away from the table, her eyes met Alex's over the surgical mask. "He will need continuous monitoring for rejection for the next 72 hours, she instructed calmly. "And I suggest maintaining the protocol I initiated." Alex simply nodded, still stunned by what he had just witnessed. As Eleanor turned to leave the room, he finally found his voice. "Who are you really?" Eleanor paused for a moment without turning around. "Just someone trying to help, Dr. Sterling." The unfinished conversation. Upon exiting the operating room, she was met by Alistair, who was waiting anxiously. "The patient?" "Stable. For now." Alistair smiled, placing a hand on her shoulder. "You're still the best, Eleanor." "That was a mistake," she replied, removing the surgical gown with hands that were now trembling. "Alex saw me. He's going to ask questions. A lot of questions. Perhaps it's time to answer some of them," Alistair suggested gently. Eleanor closed her eyes for a moment, feeling the weight of the last few years, the choices she had made, the grief that had consumed her. For 3 years, she had hidden in the anonymity of the invisible janitor. Today, for a few minutes, she had returned to being the surgeon she once was. And despite the fear, a small part of her felt alive again. The doctor's lounge was empty when Alex Sterling walked in, still wearing blood-stained surgical scrubs. His hands, normally steady, trembled slightly as he poured himself a coffee. Senator Thompson's surgery had ended only 20 minutes ago, and his body was still pulsing with adrenaline, not only from the complex procedure, but from what he had witnessed. That woman, Dr. Vance, as she introduced herself, had performed an intervention he had never seen before. The vascular repair technique, the way she had handled the transplanted heart, Everything indicated years of experience and exceptional talent. "Congratulations on the surgery," Alistair's voice interrupted his thoughts. "The senator is stable in the ICU." Alex turned, his eyes narrowed. "It wasn't my surgery in the end, was it? Who is she, Alistair? Fans don't give me that consultant story." The CEO sighed, sitting down heavily in one of the armchairs. For a long moment, only the sound of the wall clock filled the silence between them. "You're about to enter complicated territory, Alex," he finally replied. "Some stories are not mine to tell." "She saved my patient using techniques I've never seen in practice," Alex insisted. "And I'm almost certain she's the same person who's been popping up lately. The janitor who identified medication errors, who noticed potassium changes, who—" He stopped abruptly, the pieces clicking into place in his mind. "It's her, isn't it? The janitor and this Dr. Vance are the same person." Alistair's silence was confirmation enough. Why would a surgeon of that caliber be working as a janitor? Alex asked, confused. "It makes no sense. Not all choices in life have to make sense to others, Alex," Alistair replied calmly, "especially when they stem from deep pain." Before Alex could respond, the door to the lounge opened abruptly and a nurse rushed in. "Dr. Sterling, emergency in the ICU. The senator is in cardiac arrest." Alex and Alistair raced down the corridors to the intensive care unit, where a team was already performing resuscitation maneuvers on the patient. The monitors beeped frantically, indicating ventricular fibrillation, a heart rhythm incompatible with life. "Defibrillator," Alex ordered, taking control. "Charge to 200 joules!" As the team worked, Alex couldn't help but notice a figure in the corner of the room. Eleanor, once again in her janitor uniform, observed the scene with eyes that evaluated every technical detail. 3 shocks later, the senator's heart still refused to establish a normal rhythm. Alex began to feel the weight of imminent failure when Eleanor stepped forward. "Allow me to suggest something," she said in a low voice, for him alone to hear. "The hyperacute rejection may have caused coronary thrombosis. If so, defibrillation alone won't solve it." Alex hesitated for only a second before acceding to the implicit suggestion. "Prep thrombolytics and heparin," he ordered, "and continue CPR." The team promptly obeyed, administering the drugs while maintaining chest compressions. 4 minutes later, 4 long minutes where the senator's life hung by a thread, the monitor began to register organized beats. "Sinus rhythm," announced a nurse with relief. "Pressure returning." A collective sigh of relief echoed through the room. Alex looked at Eleanor, who was already discreetly moving toward the door. "Wait," he called, following her into the corridor. "You can't just leave like that." Eleanor stopped, her back tense. "My shift is ending, Dr. Sterling. I need to go." "Your shift as a janitor or as a doctor?" he asked, keeping his voice low so only she could hear. "Why are you doing this?" "Why hide?" She turned slowly, and for the first time Alex saw beyond the mask of the discreet employee. In Eleanor's eyes was a depth of experience and pain that left him momentarily speechless. "There are many ways to serve, Doctor," she simply replied. "Not all require recognition." "I saw how you operated today," Alex insisted. "Those are not the hands of someone who should be scrubbing floors. They are hands that save lives." A group of resident doctors passed by them, looking curiously at the strange pair, the renowned surgeon and the janitor, talking like equals in the middle of the corridor. "This is not the place for this conversation," Eleanor murmured. Uncomfortable with the attention. "Then where?" "When?" Alex pressed. "Because this conversation is going to happen. Dr. Vance, today you not only saved my patient twice, but made me question everything I thought I knew about this hospital." Before she could answer, a commotion at the ICU entrance drew the attention of both. A news crew was trying to get in, cameras in hand. "It's Senator Thompson. We need information about his condition," a reporter insisted as security guards tried to contain them. Alex immediately moved to deal with the press, but not before giving Eleanor one last look. "This conversation isn't over," he promised. The truth in the coffee shop. While Alex dealt with the reporters, Eleanor took the opportunity to slip away. In the staff locker room, she quickly changed clothes and removed the bandana covering her gray hair. For years, she had carefully maintained her anonymity, building a life in the shadows after everything fell apart in Chicago. Now she felt that life was about to change again. Outside the hospital, the day was already bright. Eleanor walked to the bus stop, feeling the typical morning humidity. As she waited, she couldn't help but reflect on the last 12 hours. For the first time in 3 years, her hands had held a scalpel again. For the first time in 3 years, she had returned to being the doctor she once was. And surprisingly, she hadn't felt the overwhelming weight of guilt she expected. The bus arrived, but before she could board, she heard someone calling her name. She turned to find Alex Sterling approaching quickly, still wearing his surgical scrubs under his lab coat. "Dr. Sterling," she greeted him formally. "The reporters, press relations is handling it," he cut her off. "We need to talk, and it's going to be now." There was a determination in his voice that Eleanor recognized, the same obstinacy she herself had once possessed when nothing in the world could stop her from achieving her goals. "I'm tired," she tried to argue. "It was a long night, 15 minutes. At the coffee shop across the street," Alex insisted. "It's the least you owe me after what happened today." Eleanor hesitated, weighing her options. She could simply get on the bus and leave, but she knew Alex wouldn't give up. It was only a matter of time before her past came to light. 15 minutes, she finally agreed. The small coffee shop was nearly empty at that hour of the morning. They chose a table in the corner, away from curious ears. For a few moments, they simply observed each other in silence, like two adversaries assessing each other before a decisive confrontation. "Why don't we start with the basics?" Alex suggested, breaking the silence. "Who is Eleanor Vance, really?" She took a sip of the coffee they had ordered, buying time to organize thoughts she had kept locked away for so long. "I was chief of cardiovascular surgery at Chicago General Hospital for 15 years, she began slowly. Before that, residency at Johns Hopkins, a fellowship in interventional cardiology at the Cleveland Clinic. I published 47 articles in international journals, developed 2 valvular repair techniques that carry my name in medical textbooks." Alex watched her with growing astonishment. The resume she described so casually placed her among the biggest names in American medicine. "And what happened?" he asked more softly. Eleanor looked away towards the window, watching the movement of people on the street. Normal, uncomplicated lives. "What happened is what no doctor is prepared to face," she finally replied. "Operating on your own child, and failing." The silence that followed was dense, charged with an emotion Alex could barely comprehend. Suddenly, his curiosity gave way to solemn respect. "I'm sorry," was all he could say. "Julia was 9 years old," Eleanor continued, her voice now distant, as if narrating someone else's story. "Car accident. Severe thoracic trauma. I was the only cardiac surgeon available that day. No one else had experience with pediatric cardiovascular trauma." She paused, taking a deep breath. "I operated for 12 hours. I used every technique I knew, improvised others. In the end, it wasn't enough." Alex could imagine the scene, the renowned doctor fighting to save her own daughter, the impossible weight of that responsibility. "After that, I couldn't go into an operating room anymore," Eleanor continued. "I tried. My colleagues tried to help me, but every time I touched a scalpel, my mind went back to that operating table, to that silent cardiac monitor." "So you came to New York," Alex concluded. "To start over. Alistair is an old college friend. He was the only one who didn't try to convince me to go back to operating. He understood that I needed distance, but also that I wouldn't be able to stay completely away from medicine." She offered a sad smile. "Who would notice a middle-aged janitor? I could be in the hospital, observe procedures, sometimes even help discreetly, without the burden of the white coat, without the overwhelming responsibility." Alex tried to process it all. The arrogance he had felt towards her now seemed absurdly inappropriate. "Today you operated again," he observed, "and saved the senator." "It was a mistake," Eleanor quickly replied. "A moment of weakness." "It won't happen again." "A mistake?" Alex repeated, incredulous. "You performed an intervention that no other doctor in this hospital could have done. If that's a mistake, then what is right?" Eleanor looked at her own hands, hands calloused now not only from years of surgeries, but from cleaning products and manual labor. "Dr. Sterling?" Alex, he corrected softly. Please, Alex, she conceded. This moral discomfort is not necessary. The senator is alive, the surgery was successful, and that's what matters. He turned to face her, a new intensity in his gaze. What if I don't accept that? He challenged. What if I say it's a waste of talent? That patients could benefit from your skills? The look Eleanor gave him held a mixture of weariness and determination. That wouldn't be your choice to make, she replied simply. Now, if you'll excuse me, our 15 minutes are up. She stood to leave, but Alex gently held her wrist. One last question, he asked. Why did you keep helping me even when I treated you so badly? Even when I barely acknowledged your existence? Eleanor smiled, a genuine smile this time, which lit up her tired face. Because the patients matter more than our egos. Dr. Sterling, I thought Harvard taught you that. With that final observation, she left the coffee shop, leaving Alex alone with his reflections and a half-empty cup of coffee, just like his certainties about the world he thought he knew so well. The governor's daughter. The news of Senator Thompson's miraculous recovery spread quickly through the corridors of Mount Olympus Medical Center. In less than 24 hours, the story of the complex surgery had been transformed into an almost mythical narrative, with Dr. Alex Sterling at the center as the hero who performed the impossible. Local newspapers ran headlines celebrating the feat, and the hospital board didn't hesitate to leverage the positive publicity. Dr. Sterling utilized an innovative technique never before seen in New York. Dr. Alistair Finch proudly explained at a press conference in the main lobby. It's an example of the level of excellence we seek at our institution. Leaning against the back wall, almost invisible in her light blue uniform, Eleanor watched the scene with a neutral expression. The irony was not lost on her, silently witnessing her own surgical technique being attributed to another doctor. However, there was no resentment in her heart, only a quiet acceptance of the role she had chosen for herself. You should be up there, Nurse Delilah whispered, approaching discreetly. You're the one who really saved that man. It doesn't matter who gets the credit, Delilah, Eleanor replied softly. What matters is that the patient is alive. But that's not fair, the nurse protested. Fairness? Eleanor smiled sadly. In life, we rarely find fairness. Only the consequences of our choices. As the cameras flashed and reporters surrounded Alex with questions, their eyes met briefly across the crowded lobby. For an instant, Eleanor saw something unexpected on the arrogant surgeon's face. Not pride or satisfaction, but an unmistakable discomfort. Perhaps even shame. If you'll excuse me, Alex abruptly interrupted the interview. I need to return to my patients. Ignoring the protests of the reporters who still had questions, he walked determinedly across the lobby. As he passed Eleanor, he murmured without stopping, My office. 15 minutes. Eleanor hesitated, torn between curiosity and the desire to maintain distance. But something in Alex's expression indicated that this was not a conversation she could avoid. 15 minutes later, after finishing cleaning the third-floor stairs, she knocked softly on Alex's office door. The golden plaque on the door announced in elegant letters, Dr. Alex Sterling, Cardiovascular Surgery. Come in, came the immediate response. The office was exactly as she had imagined, impeccably organized, decorated with framed diplomas and photographs of Alex, with global medical luminaries. A bookshelf displayed copies of medical journals where his articles had been published. Close the door, please, he asked, rising from his desk. Eleanor obeyed, remaining close to the exit, as if planning a quick retreat if necessary. This isn't right, Alex began without preamble, surprising her. They're treating me like a hero when you're the one who saved that man. Of all the things she expected to hear, this was perhaps the last. Eleanor studied his face, looking for signs of his usual arrogance, but found only genuine disturbance. You didn't seem like the type of doctor who minds excessive recognition, she observed calmly. I wasn't, he admitted with a tired sigh. Until yesterday. Alex walked to the window, looking at the hospital activity below. I spent the entire night thinking about you, he continued. About your story. About what it really means to be a doctor. Dr. Sterling, Alex, he corrected automatically. Please, Alex, she conceded. This moral discomfort isn't necessary. The senator is alive. The surgery was successful, and that's what matters. He turned to face her, a new intensity in his gaze. You know what else I thought about last night? All the times I passed you in the corridors, without even noticing your existence. How I treated you when you tried to warn me about that patient's potassium levels. He paused, visibly uncomfortable with his own confession. How I became exactly the kind of doctor I despised when I was a student. Eleanor didn't know how to respond. The man in front of her seemed very different from the arrogant surgeon she had met in recent weeks. We all make mistakes, she finally offered. We all lose our way now and then. But not everyone has the courage to start over the way you did, Alex countered. To give up everything, prestige, recognition, status, to find peace. It wasn't courage, Eleanor gently corrected. It was survival. A contemplative silence settled between them, each lost in their own thoughts. Outside, the hospital continued its relentless rhythm, lives being saved, lost, transformed every minute. I have a proposition for you, Alex finally broke the silence. Not as chief of surgery, but as a colleague. Eleanor raised an eyebrow, curious. What kind of proposition? Consultation, he replied. Unofficial, no pressure on your terms. When you feel you can contribute, when you want to. No obligation to operate or take on formal responsibilities. And what would be the benefit for you in that arrangement? She asked cautiously. Alex smiled, not the confident smile he displayed for the cameras, but something humbler, more genuine. Learning, he replied simply. From someone who clearly has a lot to teach. Before Eleanor could answer, the office door opened abruptly, and Dr. Alistair Finch walked in, looking worried. Alex, I need to... He stopped when he saw Eleanor. Immediately understanding, he had interrupted an important conversation. My apologies. I can come back later. No, come in, Alistair, Alex invited. In fact, it's good you're here. I think this conversation concerns all three of us. Alistair closed the door behind him, looking from Alex to Eleanor with curiosity. I was proposing an informal consulting arrangement to Dr. Vance, Alex explained. I believe her knowledge is too valuable to this hospital to remain limited to discreet observations in the corridors. Alistair nodded slowly. I've been telling her that for 3 years. And I've been refusing for 3 years, Eleanor reminded him gently. My decision not to formally practice medicine was not made lightly, Alistair. You know that. I do, the CEO agreed. But perhaps it's time to re-evaluate that decision. I'm not suggesting you return to the operating room immediately, unless you choose to. But there are other ways to contribute. Eleanor crossed her arms defensively. And how exactly would that work? The night shift janitor giving medical consultations in her spare time? The other doctors would never accept it. They don't need to know initially, Alex suggested. We can start discreetly, just between the three of us. Over time, when you're comfortable. If you're ever comfortable, Alistair completed, respecting her boundaries. Eleanor felt the weight of a decision she hadn't expected to have to make. For 3 years, she had kept her former identity carefully separate from her current life. The barrier between Dr. Vance and Eleanor the janitor was what had allowed her to survive the devastating trauma of losing her daughter under her own hands. I need to think, she finally replied. This changes a lot. Of course, Alex nodded understandingly. Take all the time you need. Just then, Alistair's pager buzzed insistently. He checked the message with a frown. The governor's daughter has been admitted to the ER, he informed them. Car accident, thoracic trauma. Eleanor felt a chill run down her spine. The words evoked memories too painful. Another accident, another young woman, another impossible surgery. Unconsciously, she took a step back. Alex, Alistair continued, we need you in the ER now. Preliminary reports suspect an aortic rupture. Alex was already grabbing his lab coat, but his eyes remained fixed on Eleanor, noticing her sudden pallor. You don't have to get involved, he said softly. I understand why this would be. What are the vital signs? Eleanor interrupted, her professional voice masking the emotional storm brewing internally. Alistair consulted the message again. Severe hypotension, tachycardia, pressure differential between upper limbs. Age? Eleanor asked. 17. 17, not 9. Not her Julia. Another girl, another family, another chance. Do you have a vascular surgeon on call? She asked, already knowing the answer. Not until 2 p.m., Alistair replied. Alex is our best option, but traumatic aortic rupture is extremely complex, even for a surgeon of his caliber. Eleanor closed her eyes for a moment, taking a deep breath. When she opened them again, there was an iron resolve in her gaze. I'll go with you, she announced, just as an observer, to guide if necessary. Alex and Alistair exchanged surprised looks. Are you sure? Alistair asked gently. Given your history. Precisely because of my history, Eleanor replied firmly. I can't let another doctor go through what I did. I can't let another family lose a daughter, if there's anything I can do to prevent it. The three hurried out of the office, heading toward the emergency room. On the way, Eleanor made a quick stop at the women's locker room. Meet me there, she instructed. I need 2 minutes. Alone in the locker room, Eleanor faced her reflection in the mirror. Memories of Julia, the accident, the failed surgery tried to invade her mind, but she held them back with a willpower cultivated over years. It's not about you, she murmured to herself. It's about that girl. It's about that family. With hands that trembled only slightly, she removed her janitor uniform and put on a clean surgical gown that Alistair had set aside for emergencies like this. When she clipped the temporary badge that identified her as consulting physician, she felt as if she were completing a circle that had begun 3 years earlier. Perhaps she would never fully overcome the loss of Julia. Perhaps she would never again be the confident surgeon she once was. But today, in this moment, she could use her pain as a tool, not as an obstacle, but as a bridge to help another family avoid the same tragedy. I'm ready, she said to her reflection, and this time, she almost believed it. Redemption in the OR. The operating room pulsed with the tense energy of an ongoing emergency. Monitors beeped, nurses moved with choreographed precision, and the cold air conditioning contrasted with the heat of the adrenaline taking over the room. On the operating table, Isabella Thompson, 17, the senator's daughter, fought for her life as the medical team prepared for the surgery that would determine her fate. The trauma from the accident had caused a partial aortic rupture, a condition with a terrifyingly high mortality rate even in advanced medical centers. Alex Sterling, already scrubbed in, studied the CT images with absolute concentration. At his side, also wearing surgical attire, Eleanor observed in silence, her specialized knowledge noticing nuances that escaped the others. The rupture is in the descending portion, just past the left subclavian artery, Alex murmured, more to himself than to the others. And there's a dissection extending distally, Eleanor added softly. See that false lumen line? Alex nodded, grateful for the precise observation. How would you approach this? It was a genuine question, colleague to colleague, without a trace of the arrogance that had characterized their previous interactions. Partial cardiopulmonary bypass, Eleanor replied without hesitation. It will protect the spinal cord during the repair. The Crawford clamp technique would be my choice for this specific anatomical configuration. I've never performed that technique, Alex admitted, something he never would have confessed days ago. I can guide you, Eleanor offered, if you're willing to try. Their eyes met over their surgical masks, a moment of mutual understanding, nascent respect between two professionals united by a common goal. I am, Alex replied simply. The surgery began. Alex's hands worked with their usual precision, but now guided by Eleanor's experience, who remained at his side, calmly directing every critical step. Proximal control first, she instructed. Now prep the bypass before manipulating the rupture area. The team watched, fascinated by the dynamic between the two. The residents exchanged curious glances, having never seen the proud Dr. Sterling so receptive to guidance from another person, especially someone most still didn't know. 3 hours passed in intense concentration. When the final suture was concluded and blood flow restored, the monitors confirmed what everyone hoped. The surgery was a success. Stable blood pressure, announced the anesthesiologist. Distal perfusion normalized. A collective sigh of relief swept through the room. Alex looked at Eleanor, his eyes revealing what the masks hid, a genuine smile not of pride, but of gratitude. Couldn't have done it without you, he admitted in a low voice for her alone to hear. You could have, Eleanor gently corrected. Just differently. As the team finalized procedures and prepared to transfer the patient to the ICU, Alex noticed something on Eleanor's face, a serenity that wasn't there when they entered the operating room, as if some invisible weight had been not removed, but accommodated in a more bearable way. In the corridor after the surgery, Alistair waited anxiously. His face broke into a relieved smile when Alex and Eleanor exited the room side by side. "The governor's daughter." "Stable," Alex replied. "Excellent prognosis thanks to Dr. Vance." Alistair squeezed Eleanor's shoulder affectionately. "How do you feel?" It was a question loaded with meaning that went far beyond the physical fatigue of the surgery. Eleanor reflected for a moment before answering. "At peace," she said simply. "Not completely, but it's a start." Just then, the patient's father, Governor Richard Thompson, approached quickly, his face etched with the worry of a father, not a politician. "My daughter," was all he could say. "How is she?" "The surgery was a success, Governor," Alex replied formally. "Your daughter is stable and should make a full recovery in time." Relief transfigured the man's face. "Thank God and thank you, doctors." He extended his hand first to Alex, then to Eleanor. "The state of New York owes you both an eternal debt." Eleanor accepted the handshake mechanically, feeling strange in her temporary surgical gown, like an actress in an unrehearsed role. When the governor walked away to see his daughter in the ICU, she turned to Alistair. "I need to change," she said softly. "My cleaning shift starts in an hour." Alex and Alistair exchanged glances. "Eleanor," Alistair began carefully, "you just performed a complex cardiovascular surgery. Don't you think you deserve a rest?" "I didn't perform any surgery," she corrected. "I merely advised." "You saved that girl as much as I did," Alex insisted. "And not just her. Senator Thompson, and how many other patients who benefited from your discreet observations over the past 3 years?" Eleanor had no answer for that. "Why can't we find a middle ground?" Alistair suggested. "You don't have to go back to full-time operating immediately. But you also don't have to keep hiding." "What exactly are you proposing?" Eleanor asked cautiously. "Official consultation," Alistair replied. "Part-time. Selected cases. No pressure to operate unless you choose to. One step at a time." Eleanor looked at her hands, hands that for 3 years had held mops and cleaning supplies, but which today remembered what it was like to hold a scalpel, to save a life. "What if I fail again?" she asked, vulnerability rare in her voice. "We all fail," Alex replied with surprising humility. "I would have failed today without your guidance." "The question isn't whether we'll fail," Alistair gently added. "The question is how many lives we'll miss impacting positively if we don't try." The silence that followed was broken by Eleanor's cell phone ringing. She checked the message and her eyes widened. "It's from the social worker," she explained in a shaky voice. "About Julia." Alex and Alistair exchanged confused looks. "I thought your daughter," Alex began delicately. "My Julia is gone," Eleanor confirmed, unshed tears glistening in her eyes. "But her heart isn't." Understanding dawned on the 2 doctors' faces. "Organ donation," Alistair murmured. Eleanor nodded. "Her heart went to an 8-year-old girl in Boston. Her kidneys to 2 different children. Her corneas gave sight to a teenager." She took a deep breath, controlling her emotion. "For 3 years I've received reports from the social worker about the recipients. For 3 years I've known that parts of her still lived helping others." "And that message?" Alex asked gently. "The girl who received Julia's heart just graduated from middle school," Eleanor replied, allowing a small smile to illuminate her tired face. "With honors in science. She wants to be a doctor one day." The symbolism was not lost on any of them. In silence, the 3 contemplated the perfect cycle that life sometimes draws, from loss to renewal, from pain to purpose. "Maybe," Eleanor finally said, "it's time to step out of the shadows. A little, at least." 3 months later, the auditorium of Mount Olympus Medical Center was packed. Doctors, nurses, medical students, and staff from all departments squeezed into the seats for the inaugural lecture of the new continuing education program. On the podium, Alistair adjusted the microphone with a satisfied smile. "It is with immense pride that I introduce the new Associate Director of Education and Research in Cardiovascular Surgery at Mount Olympus Medical Center," he announced. "A professional whose experience and wisdom will benefit not only our patients but the entire next generation of physicians. A buzz went through the audience. Many had already heard rumors about the mysterious surgeon who had seemingly appeared out of nowhere. Others were still processing the recent revelation that the discreet night shift janitor was, in fact, one of the country's most respected specialists. Please welcome Dr. Eleanor Vance. Applause filled the auditorium as Eleanor walked to the podium. She no longer wore the light blue uniform or the bandana that concealed her grey hair. In their place, an impeccable white lab coat and a badge proudly displaying her name and title, Dr. Eleanor Vance, MD, PhD. From the front row, Alex watched with respect and admiration. In recent weeks, they had worked together on several complex cases, he performing, she guiding. The arrogance that had once defined his professional demeanor had given way to a genuine humility, born from the recognition that medical excellence could come from the most unexpected sources. Thank you all for being here, Eleanor began, her voice calm but firm, filling the space. Today I will speak about something I learned the hardest way, how humility saves lives in the operating room. As she led the presentation, mesmerizing the audience with her deep knowledge and unparalleled experience, no one could imagine that only a few months earlier, those same hands that now gestured with elegance had wielded mops and brooms in the same corridors. She now walked as a respected physician. At the end of the lecture, after answering the last question, Eleanor concluded with words that deeply touched everyone present. Medicine teaches us daily that titles, positions, and status are illusions. In the end, we are all servants of life, of healing, of hope. Some serve with scalpels, others with stethoscopes, others still with mops and buckets. But everyone, absolutely everyone, is essential in the symphony of healing we play together in this hospital. The applause that followed was deafening. As she left the podium, Eleanor met Nurse Delilah's gaze in the crowd, the nurse who had always believed in her, even in the darkest days, and they exchanged knowing smiles. Later that day, Eleanor met with Alex and Alistair on the small rooftop balcony, from where they could watch the sun set over Manhattan, coloring the sky with orange hues that reflected on the glass towers. An impressive debut, Alistair commented, handing her a cup of coffee. You won over even the most skeptical. There's still a lot of work to do, Eleanor replied, looking at the horizon, and many scars to heal. Yours or the hospital's? Alex asked perceptively. Both, she smiled. But now I know that scars are not just marks of past pain. They are also proof of our capacity for healing. The three remained in contemplative silence, each reflecting on the extraordinary journey that had brought them together. Alex, the arrogant surgeon who had learned humility from a janitor. Alistair, the loyal friend who never lost faith in Eleanor's potential, even when she herself had. And Eleanor, who had finally found a way to honor Julia's memory, not through the denial of her gifts, but through their compassionate use. You know what I like most about this hospital? Eleanor broke the silence, looking at the imposing white structure that stretched out below them. That from every floor, the view is completely different. It depends on the perspective. Like life, Alex observed. Like medicine, Alistair added. Like the journey of healing, Eleanor concluded, raising her cup in a silent toast to the future that was just beginning to unfold. End screen and call to action, CTA, for YouTube. Narrator, voice, energetic and emotional. Dear viewers, we hope the story of Eleanor Vance, the hidden surgeon of Mount Olympus, has touched your hearts as much as it touched ours. It's a powerful narrative about redemption, humility, and the courage to start over when everything seems lost. To continue this emotional journey, we've prepared a special playlist with equally captivating stories of hidden heroes and second chances. Find it right here on your screen. If this story about an extraordinary woman hiding in the shadows of a hospital moved you, don't forget to smash that like button. Help the YouTube algorithm share this story of true merit. Subscribe to our channel and turn on notifications, the little bell. Every day we bring you unique narratives that explore the complexity of life, reminding us that often the most important heroes are those who work silently, far from the spotlight. Tell us in the comments. What did you think of Eleanor's final decision? Do you know people who, like her, make a difference without seeking recognition? Share your stories and reflections with us.